Epilepsy is a brain disorder in which a person has repeated seizures or convulsions over time. Seizures are episodes of disturbed brain activity that cause changes in attention or behavior. Epilepsy occurs when permanent changes in brain tissue cause the brain to be too excited or jumpy. The brain sends out abnormal signals. The results in repeated unpredictable seizures. A single seizure that does not happen again is not epilepsy. Epilepsy may be due to a medical condition or injury that affects the brain, or the cause may be unknown. Common causes of epilepsy include stroke, dementia, such as Alzheimer's disease, traumatic brain injury, infections, brain problems that are present at birth, brain injury that occurred during or near birth, metabolism disorders present at birth, brain tumors, abnormal blood vessels in the brain, other illnesses that damage or destroy brain tissue, and the use of certain medications. Epilepsy seizures usually begin between ages of 5 and 20, but they can happen at any age. There may be a family history of seizures or epilepsy. Symptoms vary from person to person. Some people have simple jarring spells, while others have violent shaking and loss of alertness. The type of seizure depends on the part of the brain affected and cause of epilepsy. Most of the time the seizure is similar to the previous one. Some people with epilepsy have a strange sensation such as tingling, smelling, and odor that isn't actually there, or emotional changes before each seizure. There are 3 types of seizures: absent seizures, generalized seizures, and partial or focal seizures. Treatment for epilepsy may involve surgery or medication. If epilepsy seizures are due to a tumor, abnormal blood vessels, or bleeding in the brain, surgery is used to treat these disorders and may make the seizure stop. Medication to prevent seizures, called anticonvulsants, may reduce the number of future seizures. One modification I can see for students with epilepsy is that they should wear medical alert jewelry, so the prompt medical treatment can be obtained if a seizure occurs. On these pieces of jewelry, they have specific directions on what to do. Other modifications for SAEs include preparing for potential seizures prior to SAE events, utilize SAEs which do not rely heavily upon memorization, and find an SAE that encourages social development. I have started to see some schools in the Superior region start training/breaking guide dogs. What a great opportunity for a student with epilepsy. Students could not only use a dog as a tool in help keeping themselves safe, and they would benefit from having a dog as a companion and friend. Epilepsy often leads to isolation. The children who lack understanding of the child's difference from them often avoid the child who experiences seizures. Even young children that do have friends may find themselves left behind by their peers as they get older if the seizures limit their activities or result in cognitive delays. However, there are few children who don't like dogs, and the miracles that occur when children with disabilities enter the playgrounds with their service dogs is amazing. The service dog breaks the ice. Children will come pet the dog, and in doing so, there's an opportunity to get to know the child and understand the disability.